Hello. Welcome, everybody. Before we commence the forum, I would like to acknowledge the traditional owners of country throughout Australia and recognize their continuing connection to land, waters, and culture. We pay our respects to elders past, present, and emerging. These are Aboriginal lands and will always be Aboriginal lands. Today, we will introduce integrated living, talk a little bit about the services and value we provide to our clients. We will also explain what government-funded services are available and how you can access them. And we will conclude with why you should choose us as partners in your journey. Before we get started, I would like to let you know that the audiences will be muted in this presentation. Please refer to the Q&A chat box on the right hand of the screen if you have any questions along the way. These will be answered at the end of the presentation. A recording of the presentation will be available on our website after the forums. And you can always contact us directly on our 1300 number at your convenience. So let's get started. On the screen, you have our operational leadership team. Today, you have myself, Indra Arunachalam, the Chief Operating Officer, and Nicole Hudson, our Head of Service Delivery, to take you through the forum. We will now turn off the camera so that you can focus fully on the presentation. And we will come back on camera at the end of the presentation. And don't forget, you can pop in any questions you have on the Q&A chat box. So let me start by talking a little bit about integrated living. We are a not-for-profit organization and a registered charity. We recognize diversity, whether in gender, age, language, ethnicity, cultural background, sexual orientation, religious belief, or family responsibilities. We have more than 1,000 staff who are local people who live in the communities we serve. Every year, we provide choice, high quality and safe services to over 20,000 clients situated across rural, regional, and remote communities. We offer health and wellness options so that clients can live an active life, improve their chronic health conditions, and recover more quickly from hospitalizations and major health incidents. To support our clients and carers through COVID-19, we continue to offer both face-to-face and essential services and have adopted to online options where possible. At Integrated Living, we are serious about choice and value. We do that by providing a range of quality services to help you to live well and safely in your own homes. We provide help at home, which includes personal care, housekeeping, meal services, and supported transport services. With our respite and social options, you stay socially connected and carers can have some time out. This includes social outings, home visits, in-home or cottage respite care. Our health services team can help you stay healthy and manage chronic health conditions. They include allied health services such as podiatry, occupational therapy, diet and nutrition, psychology, physiotherapy. Our health services team also has nursing services, palliative care, telehealth, short-term restorative care, and dementia care. Our clinicians also run Wellness for Independence program that focus on early intervention and health management to help you with your health and well-being. It is a 16-week clinician-led group program where clients learn how to use an iPad, about their chronic health conditions, and what they can do to improve their quality of life. Integrated Living also provides disability support services for people living with a disability. Services include accommodation supports, independent living, travel and transport, self and home care, nursing care, community connections, exercise and gym, meals and cooking, as well as carer support. Last but not least, our centers. We are very proud to have established award-winning wellness and activity centers. Our wellness centers include state-of-the-art gym with specialized equipment, designed for older people and people living with disabilities. Our activity centers provide a wide array of creative sessions and events to keep people engaged, connected, and have fun. Last year, we won the Aging Asia Elder Care Innovation Award for Best Dementia Care Program, and our 8-week Wellness Introductory Program was a finalist in the Best Rehabilitation Award category. This map shows the regions that we serve. Our focus is supporting communities in rural, regional, and remote Australia. Our clients and staff live in Northern Territory and ACT, Queensland, New South Wales, Victoria, and Tasmania. My colleague Nicole will now take you through the various government-funded programs that are available. Over to you, Nicole.
Terrific. Thanks, Indra. So there are a range of government programs that can be accessed by older persons, those living with disabilities, and veterans in our communities. It can be confusing, so I'll run through this and try and simplify as best as I can. The Commonwealth Home Support Program, known as CHSP, home care packages, known as HCP, and short-term restorative care, again known as STRC, are 3 programs that can be accessed via My Aged Care. The National Disability Insurance Scheme is available for those living with disabilities, and both Veterans Home Care and Veterans Community Nursing are available via the Department of Veteran Affairs for those whom are eligible to access at-home support. So let's talk about My Aged Care. My Aged Care is the starting point to access Australian government-funded aged care services. Key programs you can access include CHSP, HCP, STRC, respite care, as well as aged care homes such as accommodation, care, and hotel-type services. At Integrated Living, our focus is on in-home care, and today we will talk through the options and supports that are available in your home. Like anything, to access services, there are some general eligibility conditions. To access services via My Aged Care, you will need to be 65 years plus, or for Aboriginal or Torres Strait Islander people, 50 years and over. Accessing My Aged Care is simple. You can contact them readily by phone or website anytime. You will speak with a trained assessor whom will verify your eligibility and talk with you about your current circumstances. Ask further questions and discuss your needs and goals for future services. From these discussions, the most appropriate services and programs would be identified to suit you, and you will be provided with an aged care referral code. You can then use this referral code to action services with the provider of your choice. For many requiring low-level support, CHSP is a great way to have some help at home. The service is ideal for those that can manage but now require a little bit more assistance and support to keep them living independently and safely in their own home. Through CHSP, you can access many services via your referral code. However, some key services that are of great value to remain at home include transport, just assisting you to get around in your community from point A to point B, assisting with cooking or meal delivery such as prepaid meals or assistance in the home, reducing clutter via our crowded house service offering, and you can also use My Support app, developed by Integrated Living, enabling you to manage your services and communicate with us readily. Via CHSP, you can also access a variety of health services, such as podiatry to manage foot pain or concerns that you may have, diet and nutrition services to maintain your health, psychology services aimed at keeping you active and living well, as well as our centre-based services at wellness gyms and activity centres. So let's look through a CHSP example and let's meet Heather. Heather is 72 and she lives in Newcastle. Heather received her aged care referral code for services such as domestic assistance, transport and allied health. Heather calls Integrated Living to put her services in motion. An admission officer speaks with her to develop a service plan for the domestic and transport assistance. A qualified and experienced support worker will come to the home to provide domestic services for Heather on an ongoing basis, and vouchers will be provided to Heather to use for future transport needs. An exercise physiologist will undertake an assessment with Heather to develop an exercise plan unique for her. It is important to remember that all services that are in place for Heather are reviewed regularly with her. Should Heather have changes to her health or care needs, further services could be added to support her as required. And it's also important to highlight that a co-contribution to the cost of services may apply in some instances. I'll now pass you over to Indra again to give a run through on home care packages. Thanks, Indra.
Thanks, Nicole. Just before I talk about home care packages, I would just like to talk a little bit about our wellness and activity centres. Now, we've just seen that Heather attends the gym classes at one of our wellness centres. Our wellness centre programs are tailored to improve strength, balance, mobility, and confidence, as well as relaxation and socialization. The gyms are specifically built so that you can enjoy gentle exercises supported by our team of qualified exercise physiologists and personal trainers. In addition to wellness centers, we have activity centers. Our activity centers provide a wide array of creative and fun activities to keep you engaged and connected. Activity centers are also there to support carers to have a break. The wellness and activity teams offer both center-based and virtual programs. The main goal of these wellness and activity programs are to help both clients and their carers stay independently at home for longer. This map shows where our center-based services are located. And as mentioned earlier, we also offer a suite of online or virtual programs which can be accessed from anywhere. They are our Wellness for Independence group programs, wellness exercises, and activity programs. So let's now talk about higher level care needs. Home care packages, or HCP, provide a package of services to meet your care needs that go beyond what CHSP or Commonwealth Home Support Program can provide. If you have greater or more complex care needs, you could be eligible for a home care package. There are 4 levels based on your level of care needs, from basic assistance through to high needs. Level 1 is for older people with basic care needs, and that package comes with an annual funding of approximately $9,000. Level 2 is for people with low-level care needs, and the package comes with an annual funding of over $15,000. Level 3 is for people with intermediate care needs, and that comes with an annual funding of $34,000. Level 4 is for people with high-level care needs, and that package comes with an annual funding of approximately $52,000. Clients contribute to the cost of care if they can afford it. There are 3 types of fees under the home care package. Firstly, basic daily care fees. At Integrated Living, we have waived the basic daily care fees. Secondly, income-tested care fees. These are determined by Services Australia or Centrelink and are based on your income levels. Lastly, additional fees. And this is for any extra services that are not covered by the package, as there are strict guidelines on what the home care package can be spent on. One of the biggest difference between a CHSP and a HCP is the case management. Your home care package comes with a dedicated case manager who will bring a personalized and holistic approach to how we support you in your home and community. Your case manager will sit with you and your significant family member or partner to talk about your unique needs and goals and to co-design an individualized care plan that maximizes the package. Your case manager will engage with our multidisciplinary team of registered nurses and allied health professionals, including wellness and activity teams, to ensure we embed an early intervention, wellness, and reablement focus in our care and service delivery. Together with you, we will monitor and review your services to help you stay well and safe in your own home. As we have mentioned, integrated living provides a range of services. For home care package, we can group them into help at home and health services. Some examples of help at home are personal care, where we can help you with personal hygiene, grooming, and other personal care needs, and medication support for safe and effective medication. Some of the health services available through home care packages are nursing services for managing chronic illness and general health challenges, dementia care to support people living with dementia and their carers, holistic palliative care for people living with life-limiting illness. Let me introduce you to Graeme from Ballina. Graeme received an aged care referral code for a HCP level 4. He contacts Integrated Living to put his package into motion. A case manager will visit Graeme to assess his needs and develop a goals-based care plan. Graeme will also be visited by the health services team to assess his health needs and develop a health plan. Based on Graeme's care plans, a support worker will visit him to help him with personal care as well as cleaning and household tasks. An occupational therapist will assess Graeme's homes to develop and implement a plan for some home modifications so that Graeme can be safe and independent at home. If Graeme has any questions or would like to review his care plan, he can contact his case manager. For example, if Graeme has a skin tear and needs a nurse to do some wound care, his case manager can arrange that from his home care package. Graeme can also choose to use his home care package funds to pay for his wellness gym classes or wellness for independence group program. Basically, Graeme has choices, and his case manager can help Graeme explore and maximize his package. I will now hand you back to Nicole.
Thank you. So, what is short-term restorative care, or STRC? STRC is a time-limited program of 8 weeks, and during the 8 weeks, intensive care and support services are available, and the aim of the program is to help you slow or reverse the difficulties that you are experiencing with daily tasks. Under this program, you would be supported by a team of health professionals that will help you manage or adapt to your changing needs. In accessing this program, it is important to note that you are expected to contribute to the cost of your care if you can afford to do so, and that could be up to $10.54 per day. Under the STRC program, there are some great services available, and some highlights for many are home modifications, whereby small changes around the home that will help you to stay living safely and comfortably can be organised. We've also got aids and sensors can be made available, helping you to stay safe in your home, and also home upkeep, just general services to keep your home well maintained. Through the STRC program, there are some terrific health services also available. Again, some highlights of these are occupational therapy, supporting you through the activities of daily living, telehealth, medical monitoring supported by technology, physiotherapy, advice and support to keep you active and injury-free. And again, we also have centre-based services such as our wellness gyms and activity centres that can also form part of your program. So let's meet Neil. Neil receives his aged care referral code for an STRC program. He contacts Integrated Living to put the STRC in motion. A senior health coach visits Neil to assess and develop a goal-based care plan in consultation with his GP. A registered nurse provides wound care post-hospital discharge, and an OT will assess, develop and implement an allied health care plan with Neil for home modifications. An exercise physiologist will assess and develop a goal-based exercise plan with Neil for virtual gym classes. And again, Neil's care plan is reviewed at 4 and 8 weeks. Neil will either be discharged from the STRC program or perhaps referred to My Aged Care for other services to support him at the end of that 8 weeks. And again, remember, Neil may co-contribute to the cost of those services if he can afford to do so. Over to you, Indra.
Thanks, Nicole. Now, if you are not eligible for My Aged Care and require support, there are other options based on your situation. The National Disabilities Insurance Scheme, or NDIS, provides Australians aged under 65 years who have a permanent and significant disability with funding for supports and services. Supports and services may include social participation, independent living arrangements, and health and wellbeing services. The NDIS provides opportunity to live independently, learn, work, or be more involved in your community. How can you access the NDIS? You start by lodging an access request, and this can be done through your local area coordinator, over the phone, or on the NDIS website. The National Disability Insurance Agency, or NDIA, will conduct an assessment with you where you provide evidence of your disability. The NDIA will make an access decision where they decide if you are eligible for NDIS funding. They will then organize a meeting with you to discuss your support requirements and funding. The NDIA will develop an NDIS plan based on your functional capability, support needs, and goals. Once you have your approved NDIS plan, you can shop for a service provider. How can Integrated Living help you? You can call us to consult our specialist disability support team to discuss your NDIS plan and view our range of support services. And these support services include independent living, travel and transport, self and home care, meals and cooking, nursing and allied health therapy, exercise and gym, community connections, respite and carer support. If you are a veteran, the Department of Veterans Affairs, or DVA, can help you. DVA provides a variety of in-home and community support programs focused on assisting you to continue living independently by supporting your health, well-being, and community connections. DVA clients who have a gold card or a white card are eligible to access veterans home care and community nursing programs. Let's start with how veterans can access Veterans Home Care, or VHC, services. You contact the VHC assessment agency. An over-the-phone assessment is conducted and a VHC care plan is developed with you. The VHC plan is sent to you and your service provider. When your service provider receives the care plan, they will call you to put your care plan in motion. The types of services that you can access under VHC are domestic help, personal care, respite care, and safety-related home and garden maintenance. You will be asked to make a core payment towards the cost of providing VHC services. Now let's look at how veterans can access community nursing. Your GP, hospital discharge planner, or VHC assessment agency can make a referral for DVA community nursing. DVA will contact the service provider, who in turn will organize for a registered nurse to contact you to confirm eligibility and assess your care needs. Together with you, the nurse will develop a community nursing care plan and implement it. How can integrated living help you? Our nurses can assess your eligibility, care needs, and develop your nursing care plan. Our health services and service delivery teams can help you with medication, wound care, hygiene, showering, and dressing. There is no copayment for DVA community nursing. Now we come to the part about why choose integrated living as your partner or service provider. We are a team of passionate professionals who are committed to delivering customized and integrated services that support individuals in your community. Our emphasis is on safe and dependable service delivery. We have highly qualified clinicians that include registered nurses and allied health professionals to provide clinical pathways and support for our clients and carers. We support our clients to use technology to improve communication and improve access to services. We have wellness and activity programs that are both center-based and virtual. We have award-winning programs that are recognized nationally and internationally. Our focus is rural, regional, and remote Australia. We are local people who understand our local communities. We want to make sure that people in the bush have equal access to high-quality services. We are a not-for-profit organization that reinvests in delivering better health and well-being outcomes to people living in community. As our tagline says, we're all about supporting individuals and enriching communities. So now the camera should be coming back on.
Thank you all for attending today. And if you do have any questions, please pop something in our Q&A. But if you do want to contact us for further information, please call our customer service centre on 1300 782 896, or feel free to visit our website at www.integratedliving.org.au. And thank you again for joining us this morning. Take care.